I am Dr. Suzette Mikula, Otolaryngologist at MedStar Georgetown University Hospital. One of the things that led me to become an otolaryngologist is the relationship that I can develop with patients through the progression of their condition or disease. I'm specialized in otolaryngology, but since I'm also board certified in sleep medicine, I try to use a more holistic approach in the care of my patients. So when patients come in with complaints, including chronic fatigue, that can encompass not only chronic infection, but can also, be a cause of their chronic sleep deprivation or chronic sleep problems. So I also try to look at that. In addition, patients have environmental allergies, and believe it or not, this can also impact your sleep and also impact your sinus problems. When you have chronic sleep deprivation, that can affect you in all walks of life as well as your health, and it can lead to medical conditions such as hypertension, cardiac arrhythmias, type 2 diabetes, gastroesophageal reflux disease, and so on. For a patient who comes in, let's say, with a snoring problem, because I am board certified in sleep medicine, I can see that patient and figure out their specific diagnosis, send them for a sleep study, confirm or not confirm that they have that problem, and then treat them either medically or surgically, or sometimes with a non-invasive treatment in the office. It feels great when I can treat someone who has a sleeping problem that's affecting all walks of their life and help them sleep well. An otolaryngologist is someone who cares for patients with disorders of the ears, nose, or throat, commonly known as ENT. However, there's a lot of overlap with other subspecialties. For example, there's overlap in the field of neurootology, in pediatrics, in laryngology, in facial plastics, in head and neck surgery, in allergy, in sleep medicine, and we continue to expand. The most common disorders I see are snoring, chronic sinusitis, allergy problems, and nasal disorders. We actually are the sleep surgeons. So it's important for us to understand and know about how different sleep disorders can present. The most common symptoms that patients complain about are snoring, chronic nasal congestion, and postnasal drainage is another one. Oftentimes they'll complain about cough. That's related to chronic postnasal drip, or it could also be related to gastroesophageal reflux disease, which is another common thing that we overlap with, gastroenterology. So one of the things that brings patients to me is when they're having recurrent sinus infections and they're just not going away with multiple courses of oral antibiotics, or they've been treated with over-the-counter antihistamines or over-the-counter nasal steroid sprays, and it's just not working anymore. When patients come to see me, I often use tests to diagnose their conditions. This can include a home sleep test that we have available in our department that the patient goes home with and wears at night and then brings back in the morning. This is something that we set the patients up with in the office and explain to them how to use it, which is very simple. And almost always covered by their insurance. We also do blood testing for allergies, and this doesn't require that they have to stop their antihistamines ahead of time. We could just actually send them for the allergy test on their first visit to figure out if they have that condition or not. We also can send them for radiologic imaging studies such as CAT scans to diagnose chronic sinusitis. Some of the common symptoms for obstructive sleep apnea include waking up feeling tired, not refreshed, having excessive daytime sleepiness, waking up with a morning headache, feeling like you're in a fog or feeling like you're dysfunctional at work. The reasons for sleep apnea are multifactorial. It's not just weight, it's not just age, it's a combination of things. It also has to do with neuromuscular tone, and it can have to do with fluid shifts that occur after you lay down. A lot of it is related to anatomy, and definitely weight is definitely associated and sometimes can make it worse. So not all patients who snore have obstructive sleep apnea, but most patients with obstructive sleep apnea will snore. Sometimes people, or oftentimes people with obstructive sleep apnea will also grind their teeth. It's a way of naturally stenting the airway open. So that's always a worrisome finding in patients who snore, and then we look at their oral cavity and see that there's evidence of grinding, or maybe their bed partner hears them grinding as well as snoring. When patients come to see me for problems with snoring and I feel that they have risk factors for obstructive sleep apnea, I will usually set them up for a sleep study, which could be often a home sleep study or an overnight sleep study. Once I get the results of the sleep study, I usually have them come back to the office and we discuss the treatment options. Usually the first thing that we try them on is the CPAP machine, the continuous positive airway pressure, using either one of 3 different types of masks, the nasal mask, the nasal pillows, or the full face mask. They try this for a period of time, usually about 4 to 6 weeks. If they can tolerate this treatment and they feel relief, that's pretty much all they have to do, but we do monitor them and we obtain data reports after a few weeks to ensure that it's eliminating the obstructive sleep apnea effectively. If they don't tolerate this, then we discuss alternative treatments such as surgical options with them. With the home sleep study, this is a unit that we have in our department that's a very simple thing to do. It's not very complicated like when you go for an overnight sleep study. Nowadays, insurance is not covering overnight sleep studies as often, and it's not always appropriate to send someone for an overnight sleep study when it's pretty clear that they have a condition known as obstructive sleep apnea. A home sleep study can just help confirm that or not. CPAP is continuous positive airway pressure delivered through a mask. that is used to treat patients with obstructive sleep apnea. This is usually the gold standard for treatment of obstructive sleep apnea. However, if patients do not tolerate CPAP and cannot use it, surgical treatments can be used to effectively treat obstructive sleep apnea. When you use a CPAP, there are 3 different masks that you can try. And these are really 3 main categories of masks. And this includes nasal pillows, which is almost like a nasal cannula underneath the nose. Then there's a mask that goes over the nose only. Then there's a mask that goes over the nose and the mouth. You need to use the CPAP every night in order to prevent the symptoms that include, morning headaches, excessive daytime sleepiness, feeling like you're in a fog. There are surgical treatments, and there is actually a new surgical treatment called the hypoglossal nerve stimulator, which is something that we are doing within the MedStar system. If it's mild obstructive sleep apnea, there are some non-invasive office procedures such as radiofrequency coablation of the soft palate, which can also really help with snoring. There are also some implants that can be used to also help with snoring and some very mild obstructive sleep apnea. So after they have this type of surgery, they usually have to heal from the surgical incisions, which cause some swelling, and so it will take a period of time before they actually start to feel the benefit. But there are some people who have significant airway obstruction where they can almost feel immediate results. One of the things that can occur with obstructive sleep apnea is falling asleep at the wheel. And there are people every year that fall asleep at the wheel and either cause death to other people or injury to themselves or death to themselves. So that is a real risk. Other risks involve development of hypertension, development of heart arrhythmias, problems with diabetes type 2. All of these things can be a risk, can be a result of not getting treated. Also, in addition, if you don't treat your obstructive sleep apnea and it's moderate to severe, studies have shown that it definitely takes several years off your life. Dieting can actually help reduce the severity of the sleep apnea, but it often does not eliminate the obstructive sleep apnea. And if we only rely on diet, this could take a very long time that the patient would be without effective treatment of their obstructive sleep apnea while they're trying to lose weight, which we all know can sometimes be challenging. When patients come to see me at MedStar Georgetown University Hospital, I can use more of a holistic approach in my care for them. So if they're snoring, I can figure out if it's related to a sleep disorder such as obstructive sleep apnea, or if it's related to a sinus problem such as nasal polyps, or if it's related to a nasal obstruction type of problem such as a septal deviation or a nasal valve problem, and then arrive at a diagnosis and treat them all in one stop.